Hey there, have you ever had a visceral reaction or response to something? Maybe you wondered what else is there about the viscera and what they really are. And there are specialists that actually help people to make sure that their viscera are moving properly. Today, we're going to be talking again with the doctor of physical therapy, Stacey Gresham, on visceral manipulation, what it is, and how she specifically helped me with it when I was recovering as part of my pelvic floor therapy dysfunction. I know that being patient with our bodies and giving ourselves grace is a challenge for so many of us on so many levels. But be sure to stay tuned until the end because Stacey and I do discuss those really fun inside the actor studio style questions from James Lipton, if you ever watched him. So stay tuned until the end and let me know what you think in the comments. Check out the show notes if you want to reach out to Stacey. Welcome to Hill Talks Midlife Podcast for your body, mind, spirit, and business. As an occupational therapist turned entrepreneur, I have done a lot of learning, and my hope is to share these incredible people that I've met along the way with you so that we can laugh, learn, and grow together. I am your host, Hillary Baggett of Community Bloom and the Women's Midlife Network, and I'm truly glad you're here. In episode 69, I was talking to Doctor of Physical Therapy, Stacey Gresham, on more to learn about your pelvic floor. Well, welcome back to Stacey as she talks to us about our viscera. And we're going to talk about visceral manipulation. People will say, the what? But I wanted to talk about visceral manipulation because that is, again, another specialty area. And I am unique as a therapist in that I am not a specialist. I am a generalist, and I have this super broad perspective of all these different things. With visceral manipulation, could you tell me, what is it that you're doing?
Yeah, you did a great job explaining it earlier, kind of understanding that there are organs within the abdominal cavity. So that's essentially below your rib cage to your pelvis. And all the organs that sit within that area need to have normal motion. And this was something that was totally new to me. I just thought, it's a static thing that sits there doing its job separate of the rest of the body. But then when you really imagine what needs to happen for function, and even when we bend over to pick up a pencil off the floor, all of those areas have to move in combination to be able to fold through our abdomen without feeling intense pain, without getting in the way to let us reach the floor. And so there's so many pieces that really have to move in combination together. And so this idea of how viscera or organs slide over top of one another and move as we rotate and twist and bend, and how they function internally, physiologically. When we think about what's happening within the cells, say of the liver, we need those areas to be able to move and process and clean out appropriately. Exactly. And so there is this normal, there's some big fancy words called insphere and exphere, but essentially this rotational movement, this gentle sliding and opening that's happening all the time, this rhythmical motion within our body that we don't even perceive that it's happening. But when stuff gets stuck, when stuff doesn't move appropriately, if we've had surgeries within our abdominal cavity, even if they're laparoscopic, even if they're small incisions, the scar tissue can form and impede these movements. Same idea with inflammation, with infections, with all sorts of things that just happen to us throughout a lifetime that our bodies need to process. If this movement gets impaired, we start to feel dysfunction. And so there's ways of addressing this externally. It doesn't have to be a surgical option. It can be gentle, hands-on pressure and approach in order to help to restore function in these areas.
And you also introduced me to this microcurrent stimulation called the dolphin stim. I'm just going to go in for therapy and let the pros do it. I thought, gosh, I've got a lot of scar tissue after 2 laparoscopic procedures. It's fascinating what can happen. One of my scars is almost a year old, and I did a little scar work on it just last week, and things were moving and changing like they had not before around one of my itty bitty scars. So it's just really transformational. But for visceral manipulation, how long until someone can notice changes in how their organs are moving or how they're breathing? For me, I know it was I breathing freer? Was I feeling less stuck?
Yeah. And again, for each person, it's a little different. And so I think knowing how long that issue has been going on can make a difference for how quickly someone might feel change. But at the same time, I've had patients feel it within one session. Oh my goodness, again, I often hear this like deep breath or sigh, like people can fully inhale afterward. And it's just so amazing. That's where some of that pelvic floor and visceral worlds sort of come together, because this ability of our body to manage pressures within our body, essentially our lungs have to have this negative pressure in order to inhale. And so that means our diaphragm has to push down, sort of this dome muscle push down into our abdominal cavity in order to take this nice deep breath in. If our organs in our abdominal cavity are feeling dense and tight and so much pressure, I hear so many people talk about bloating and just discomfort and pressure in their abdomen. It's really hard to take a nice deep breath in. And so this whole idea of how this pressure systems work throughout the body, we have to think about how all those things function. So if we, do some mobilizations to remove some pressure, some adhesions, some people can feel it within that first session. For others, it can take months for them to feel change. I think it's really important to hone in, though, on your own body and sort of take this exploration into yourself. I have a lot of people journal, and that really helps them get in touch with what they're feeling. For some people, they'll notice small changes within about 4 to 6 sessions. And for others, it might be a bigger change, but that initial start, feeling like you're on the road to feel those changes, whether it's digestion. I'll hear a lot of people talk about the sense of relaxation or calm. And when we stimulate the vagus nerve, which is one of those cranial nerves that supplies all of our viscera in our abdominal cavity, a lot of people get this sense of calm. This anxiety is relieved from them. They didn't know where it stemmed from. And just improving that tone on that nerve can really help. And so, again, for each person, it's going to be different. So it's really important, if you take a good history, if you understand what your baseline is coming in, you'll be able to identify what are the symptoms that I feel changing. How is my body shifting? If I'm not feeling anything, that's important too, because we talked before about getting to that root cause. If it's not within that area, or if that area is just a secondary recipient of that dysfunction and it's not the true cause, we'll feel better a little bit and then it'll rush back in and we'll still feel all that dysfunction. So I think it's really important for practitioners and patients together to dive deep into sort of creating this timeline for when did this dysfunction start? How long has it been going on? When did you notice the shift? Because then we can really trace back, gosh, you've been having this problem under the surface for 20 years. This might give us a better idea of how long it will take us to unravel some of that dysfunction. And that way, if we set our expectations as, it took a long time to create this dysfunction, I need to be patient with my body. I need to give it grace and allow time for healing. And I can feel that maybe in 6 sessions, I'm on the road, but I'm not there. And so I need to give myself time to make these changes, to allow myself to be in the next place and really, again, reinterpret what is my biggest issue now. For some people, that changes across their rehab journey. They came in for one thing, that's resolving, but they're noticing something else really coming to the surface. And so I always am notorious for having a hard time with our current medical system and the insurance world that says, just work on this one thing. Because I think we're a whole body and we function as a unit, and we really want to get to the root cause and to really restore deep, lasting function for people. We really need to address more than just this one thing.
Oh, I love it. I love it. Absolutely. Because we are we are a mind and a body and a spirit together. And you can't just treat, the hand, because that could be tied back to something else. And Oh, so good.
Yeah,
So good.
that's that question.
Yeah, well, I think so. I mean, it's complicated because people that come in very tight with all these movement patterns and holding patterns and protection, they have to build that trust, and their body has to trust the person in order to release and let go. And we often call it unwinding with our fascia and things that are wrapping the organs. And it takes a little time. I think people are like, well, I tried this person once and I didn't like them. And I love the encouragement of, plan 4 to 6 sessions and go from there. And it's true, we are all onions, and chances are the reason you came in, there's probably some complicated stuff. So give yourself and your body and your mind some time and some grace to let it go.
Yeah.
Oh, so good. So good. Well, the last kind of serious question, but what would you like the listeners or readers to know about the pelvic floor? Is there anything like, man, I really wish people knew this?
Yeah. I think, I'm still learning on this journey and figuring out more and more about how everything is tied together. I did not come from a place of trauma. And so recognizing that there are so many different reasons why there can be dysfunction in that area, and finding really this multidisciplinary approach to addressing your dysfunction. And you talked about that. You have a team of people who helped you move forward and find better function in life. And so I think it's really important to recognize that your body is unique, that you are going to have a lot of different things sort of speaking into why stuff might be going on in that area. And so it's really important for you to search different reasons why there may be some dysfunction, something holding back. I really believe that the body is meant to heal itself. And so essentially as therapists, we're just there to guide and remove barriers in order to let the body take over and do what it naturally, instinctively wants to do, which is heal and repair. And so I think in the pelvic floor, recognizing that dysfunction does happen and it's okay to talk about, that there is someone out there to investigate or help with, discovering what is going on. And again, in my own personal journey, recognizing, gosh, I'm so good at contracting every other muscle in my body. How is it that I don't have control of this region? Letting go of some of that feeling of inadequacy and being able to access that area and freely receiving help, understanding that you need to find that right fit in the person that works with you, and clearly communicating. One of the things I really appreciate about my physical therapy practice is this openness and communication to really feel okay to talk about hard things. You know what? I haven't seen any change for the last 3 visits. What do you think's going on? And we can really talk about what other pieces haven't we explored. And so I think really being open and honest with the person who's trying to help you heal is so important. And as therapists, we need to be really open to receiving constructive criticism and honest communication, not coming from a hurtful place, coming from a place that wants to continue to improve and heal. And I think that's how we all grow and improve. I think for pelvic floor, again, that idea of recognizing it's very complex and that there is going to be different levels of healing that is possible in that area, and being okay with, you know what, I'm really searching after getting 70% better, and I will feel like myself if I can get to that point. And for others, it's, I want full resolution of this issue, and I will search to the ends of the earth to find whatever I can do to support my body getting all the way there to heal.
Oh, that is so wonderful. What a great perspective and encouragement. And I think even just of the 4 team members that I worked with, some people are totally open to working with the emotional aspects. Some people like you are especially trained in the visceral aspects. And if emotion comes out, it's fine, but it's not what you're seeking necessarily. One of the team members was, hey, I am orthopedic based. I'm going to feel your muscle and we're going to look for strengthening and relaxation. And then we had a team member that's like, bring it on, baby. Anything you got on trauma, sexual dysfunction, I'm your person. And so it was like, okay, I knew what I could bring and release to which person. And it wasn't superimposing, well, you're not like this person. No. This person is gifted in this area, so I'm going to address these issues here. Now you're gifted in this area, so I'm going to address these visceral manipulation issues with you. And each one was gifted in each area. So there's not a wrong person or a good or bad therapist. It's finding the right fit to meet the needs of the patient. Yeah.
Absolutely. And I think you hit on it. You could really open up in certain areas with certain people and just being honest about who you are. You bring your own experience to the table. And I'll be the first to say, I don't have this trauma background, but man, is it so important. So I was so grateful to have others on my team to be able to say, I'm really sensing, this thing that I feel like Megan would be an amazing fit for you, and being open to share and to really seek after that multidisciplinary care to get lots of people on your team to help identify different reasons and different parts of healing that need to happen for you.
Yeah. I didn't realize how complicated I was until I went to pelvic floor physical therapy. I think my family and friends would say, no, we knew you were this complicated. Oh. Well, excellent. Well, I have loved our conversations, and I am so incredibly grateful for you, Stacey, and I appreciate you coming.
I just am so grateful for the opportunity to share and to learn from you. You have such a great way with words, and I'm just amazed at your own self-advocacy and your transparency to share with your listeners, just your own journey, and be so forthright and forthcoming about what you've been through and how that's helped guide you to where you are now. And I hope they can find the same thing as well.
Oh, thank you so much.
Thank you so much for the time.
So back in season 1 of Hill Talks podcast, I used to ask these kind of James Lipton style inside the actor studio questions. And some people said, hey, I don't really listen to those. And some people said, hey, why'd you stop? So I thought, well, we'll try this again and we'll see. So Stacey, tell me, what is your favorite word?
Grace. Grace. I just love this idea of receiving what we don't deserve. And I almost named my daughter that, except for I have a little bit of a clumsy streak in our family, and I was just scared she'd get made fun of in middle school. But grace is my favorite word.
I love it. And what is your least favorite word?
Bullying. I just, that idea of picking on someone else's vulnerabilities or weaknesses just kind of cuts to my core. I hope we can eradicate this idea of not being kind to others, to not understand where they're coming from.
Yeah. That makes sense.
Yeah.
Next, what brings you the greatest joy?
That one's easy. My kids, time with them and just getting to learn who they are as people. It's amazing to watch them grow in their personality and how they interact with the world. It's the best.
And today, what are you most grateful for?
You had mentioned earlier, I got to expand into having my own practice, and what that has done has been able to really give me time with my 4.5-month-old son. We just get to enjoy time together without feeling rushed, without feeling like there's a million other things on my mind that I need to do. And I'm just so grateful for that space to just be present with him and really connect. And this idea of attachment, really being able to pour into him and not feel like I'm distracted at all. It's been really wonderful.
Oh, good for you. What a claiming, your own voice and giving yourself permission to not feel like, okay, I've got to get back to full-time work again, or I've got to do this, and listening to what you and your family need. So bravo.
Yeah, it's been great.
Next question. What sound or noise do you love?
My children's laughter. My my middle son has the most infectious laugh, and he'll just keep building on it all the time. And now my youngest son has started to giggle, and it's just the sweetest, most freeing thing in the whole world. I just love it. I can't get enough of it.
I love it. And is there a sound or noise that you strongly dislike?
I think as a mama, you sort of, especially, I'm a very empathetic person, so I feel other people's pain. And so, again, I'm in the season of having young children. And so that overtired cry from my son, where I know if he can just close his eyes and get some rest, he would feel better, but he just can't let go. It's just the most helpless feeling I have, just to hold him and rock him through it, but to know it'll be over soon. It's just a few minutes, and then he'll find peace. But that cry just breaks my heart every time.
Oh, that's a tough one, right? Oh,
yes.
Goodness. Oh, well, is there a profession other than your own that you would like to attempt?
I always have this idea that one day when I retire, I will open a coffee shop. And even recently, I've thought about, like, what if I could just bake bread every day? I'm a morning person. This idea of getting up early, of kneading dough, having something that's just a mindless task, but that you can sort of, again, that introverted side just wants to have some peace and quiet and be alone with my thoughts. That sounds like a lovely way to spend my retirement years.
That sounds lovely. And what profession are you so thankful you will never have to do?
Oh, I think, my husband even had to do some of this customer service work over the phone, where he couldn't be there in person with people, but they called in with some grievance, and they were very frustrated, and they just had to let out that anger in that moment. And I really, want to connect with people on a deep level and understand where they're coming from. And this idea of someone being deeply upset at their core and not being able to fix their problem just gives me so much strife and anxiety. So bless those people who help people through that, because I could not do it.
Okay. And last question, you and I share our faith. And what would you like to hear God say when you arrive at the pearly gates?
Well done, good and faithful servant. Welcome home.
Yeah. Yeah, I think that's what we're all looking for, is just to have we made a difference? Have we fulfilled our mission and purpose here during this lifetime? And yeah, I love that.
Well, my daughter just recently accepted the Lord as her Savior, and it was such a great thing. We got to talk to her about it this weekend. She went away to Christian camp, and she got to tell us about the experience and all this time, building and teaching, and to have her come to that understanding. And she said, she's 9, and she said, Mom, they explained it like they're just having a big party up there in heaven. And so I can't wait to get to the party.
Oh, that is wonderful. Well, Stacey, I'm so thankful for you sharing kind of these personal and intimate moments. You are such a gift with your hands, with your ears, with your heart, and with your words of encouragement. So thank you, and I wish you all the best with your new practice and with your newborn, and congratulations on the baptism of your daughter. It's just so many things to celebrate and look forward to, and on those tiring, sleepless nights, you can remember, no, this is the dream. This is the dream.
Absolutely. And thank you for having me on, and for all that you do, both in your own world and again, reaching so many people this way in the podcast, and just being able to share your heart and your journey, and to let others connect with you, and hopefully help bring them along as well. It's such a gift to have you in my life, and I really appreciate you inviting me on.
Oh, thanks so much. Until next time, Stacey.
All right. Thanks, Hillary.
Wow, I just loved learning about giving our bodies more grace, giving ourselves kind of that time and patience to unwind and to just make a difference in ourselves and communicate with our practitioners. So in case you missed Stacey's episode 69 about pelvic floor. Go back and catch that. And her details to reach out if you're in Colorado Springs are in the show notes. Who are you going to share this episode with and encourage them to subscribe or follow us for free on Apple, Spotify, Audible, or Google? Thank you for tuning in, for listening, and for sharing. This is Hillary Baggett with Hill Talks Podcast. Listen in and know you are not alone, especially in midlife. Hey, thanks so much for listening. I appreciate it. Please subscribe and share this with a friend, another woman who is 40 and better who needs some encouragement today. Thanks so much.